Thank you, Mr. Chairman, Ranking Member Heiss, and to the congressional staff. Thank you for inviting us here today to talk about these issues. I am the Executive Director for the Blue Ribbon Study Panel on Biodefense. In addition to having a doctorate in public health and having spent 30 years in the biodefense arena, I am also a Desert Storm veteran. And I bring that up really only because I know what it feels like to be operating in an arena under the specter of biological warfare. I know what it feels like to be wearing chemical protective overgarments and wonder if they are going to protect me from a biological agent. I know what it feels like to be taking a vaccine that just the week before got emergency use authorization for me to take. And I know what it feels like to be standing on a battlefield wondering if antimicrobial resistant anthrax or some other biological agent have been loaded into a Scud missile and are coming my way. I mention all of this because I don't want anybody in this country, particularly in this country geographically, to ever have to feel any of those things. And I know that you don't either. I'll just add one other point here, and that is while we haven't had any other biological attacks since the anthrax events of 2001, we still have all of these white powder events. I believe it was today that the DeKalb County Courthouse had to evacuate for what seemed to be a rather significant white powder event. That turned out not to be anthrax from what I understand, but just imagine how all of those people felt. That is a highly busy courthouse. There's a lot of people in there all affected at once. I have submitted my longer written statement for the record, but just want to make a few points here. The Blue Ribbon Study Panel on Biodefense addresses the entire spectrum of biodefense. So we're looking at prevention and deterrence in terms of the State Department and the Defense Department and the intelligence community. And then we look at everything beyond that as well: preparedness, detection, response, attribution, recovery, and mitigation. And when you hear that list, you think about what that must mean in terms of the government. This is a huge governmental set of activities. All of the federal departments, 8 of our independent agencies, and 1 independent institution that we know about all contribute to biodefense. That makes jurisdiction and oversight here in the House and in the Senate, obviously, extremely difficult and challenging. But I think that it points very directly to this particular committee and the need to exert oversight from here, because you have the entire picture and look at the entire government. We issued a report in 2015 called the Blueprint for Biodefense. In it, we have 33 recommendations and 87 action items. And we assessed the state of biodefense here in the country, looking at strengths and weaknesses and vulnerabilities. And the nation remains vulnerable to this day. In short, the nation is not prepared for biological outbreaks, acts of bioterrorism, biological warfare, or accidental releases with catastrophic consequences. And I think that's where the national security issue comes into play. Not to say that the onesie-twosie disease events are not worthy of our concern, but we are talking about catastrophic events that would affect the effective functioning of our entire society. The National Biodefense Strategy that was mentioned earlier is actually one of our recommendations from our blueprint, as was this coordination council, although we wanted to see both of those activities run out of the White House. When you have so many governmental agencies involved, we believe you need somebody above them all to run them all. The strategy has come out, as you said, Mr. Chairman, but the implementation plan for that strategy is still pretty thin. The Department of Health and Human Services has been charged with working on that implementation plan, but they face the challenge of trying to get information out of all the other departments and agencies to inform that plan. I hope it doesn't take as long to produce that as it did to produce the implementation plan for the National Strategy for Pandemic Influenza. President Jimmy Carter issued that requirement to the Department of Health, Education, and Welfare for the strategy and the implementation plan, yet it was only released by President George W. Bush, however many decades later, and pulled away from the Department of Health and Human Services. Just quickly about antimicrobial resistance, the panel is very concerned about antimicrobial resistance. AMR would exacerbate all the types of threats that I mentioned earlier. Our national policy, which seems to focus quite a bit on hospitals and healthcare, looks at these individuals, these patients, and then says we have to get them out of the hospital as soon as we can, because we're trying to reduce their exposure to these resistant organisms within these hospitals. I would leave it to my colleagues to discuss how effective that actually is, but it's not a national security policy. It's not good national policy. If we were to be attacked or experience a naturally occurring disease that has become resistant, that affects a large population or populations here in the United States, we would have no place to discharge them to. There would be no place for them to go. So thank you very much for your time and letting me go over a minute, Mr. Chairman. I appreciate the opportunity.